cases, we are going to use the fractional. Most of your indication is going to be the fractional. The ablative, you can use it when you have an age spot, one lesion, an age spot, solar lentigo, or sometimes when you...
Solar lentigo?
Yes. If it's just simple solar lentigo, you can use it. I mean, it bends.
Yes, but it can make...
Post-traumatic pigmentation. It's not like CO2. The risk is not so much. And that's one of the reasons why you can use it also on dark skin types. CO2, you cannot use it over skin type 4.
Yes.
5 and 6, it's going to bleach it. It's going to become Michael Jackson. It becomes white. And now they found something else. I don't know if you heard it. People that they were treated with CO2 facial and neck, their salivary glands, they were inactivated. It affected the salivary glands because it's very deep, exactly, because the CO2 is 10,600 nanometers.
Yes.
Here we're talking about, and I said it yesterday, I said it's specially made for aesthetic medicine. My friend, she had a treatment in a plastic surgeon in Cyprus for dilated pores like this with CO2. This side, it became one scar, big scar, and now we're trying to repair it with Erbium. And I have many plastic surgeons in our area that I have a friend of mine, he told me, if I decide to terminate my career, I'm going to start using CO2. CO2 is good when you want to make incisions, when you want to cut, when you want to... And soon we're going to have on this a new program that you can upgrade it on, and you can use it. It will be a continuous emission, 0.5 millimeters. So you can cut also. You can remove very easily skin tags, any other, whenever you want, whatever you want to remove.
Yes, for the continuous.
It's going to come very soon. I was told we had a meeting in Biotec. It's under.
But we have already for continuous Erbium here.
No, not yet.
Not yet?
Not yet. It's coming now.
But this is the one, so...
No, this is the ablative. We're going to see. But then bring also a piece of paper, because we try on a piece of paper first. So first I want to wash my hands before we. For example, you have a hypertrophic scar and you want to remove it, you can work with this, with the ablative. Now, if I put 2 stacks, it's going to give me, look now. Frequency it's 4. I'm going to put 2. It's going to go 12.6 double.
No.
Yes.
Look.
Yes.
Now it's going to make bam bam. Where is it? Let's put 3 stacks, so you can see. So you can see how it's going to. 3 stacks. But on the skin, it's going to be much more. See?
2 in 1.
3.
3. Yes.
3 stacks.
3 stacks.
On the skin, it's going to make a hole.
Yes.
Oh, yes. Yes.
Yes. Surrounding tissue.
Yes.
That's why you have to you have a low percentage. Here there is no problem. It doesn't destroy surrounding tissue. This is the reason, probably, as I understand. That's why we have almost, you see, the coverage is almost complete. We have, let's say, every 0.5 millimeter we have emission continuously. Yes, yes.
Without diffusion of the temperature.
Because
Yes.
there it's actually that's the, I have it in the presentation. Now I understood what you mean. Is that the 10,600 millimeters?
So,
Bravo. That's what I was going to say. We have two ways to control our depth, either with or even deep. If there is severe, yes, yes, and you can work locally if there is
only.
yes, if
and
there is
after
no
that we
healthy to work and produce. So there is not such limitation. That's why
It's more accuracy that
more.
safer.
Yes, yeah, absolutely. That's why you use it on dark skin types. That's why you don't need local anesthesia. Maybe I will use local anesthesia on fractional, on deep.
Okay.
If I want, yeah.
With the stack 3 or stack
Yes, with many stacks. The only problem is that when you use stacks, you go only one
Deeper.
pulse. You go deeper, but you make one. Give me the paper. Fractional all ablative. If you work with stacks, let's say we put 2 stacks. It goes to one per second. It's for small areas.
It's no problem for your finger.
No. I feel it, but no problem. See?
I can try.
Look.
this is 2 stack.
Yes.
Just
The stacks, you are primarily going to use them on the ablative. When you want to remove something, a skin tag, lentigo, age spot, anything you want. But don't be afraid about the hyperpigmentation. As long, of course, as he has to take care.
Yes,
Yeah.
of course we have to.
What I prefer to do, if I want to go, this is a big advantage. When you work with CO2, it's deep. 10,600 nanometers, they cannot change. It's there. Now, with Erbium, you can make a very, very superficial ablation, skin regeneration for someone that she doesn't have any problem with shallow. And
How we work shallow. Zero.
bravo, that's what I was going to say. We have 2 ways to control our depth. Either with pulse duration, 0.5 is completely shallow, very shallow, and it goes up to 2 milliseconds, that it's deep. So the longer the pulse duration, the deeper it will go.
Yes.
If you want to go even deeper, you can use the stacks.
Stack.
So
Deeper than 2.
deeper than the 2 milliseconds.
Yes.
It's like an escalator, like a sensor, that it goes -2, -3, bam, 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 and goes. My commendation, don't go over 3 stacks. Because sometimes, even on 3 stacks, you can see some kind of pinpoint bleeding, which means you reach the papillary layer and you don't need to go further for any indication. Now, unless there is some special reason you want to, yeah.
So we have bleeding when we do.
No.
No.
You have to go deep over 3 stacks. You don't have any, nothing.
No need.
No.
To work,
And for
more than
eyes,
3
we
stacks.
need the protection of the
There is the special caps that goes on the pupil, yes.
I have.
Yes, there is also there is disposable, there is and then you can work also on the eyelid. Otherwise, what I do,
you can
I take one spoon, I turn it like this, I put it, absolutely safe, and I can work very close. And you turn it, you bend it.
an external.
Yes, don't keep it straight. Make it angle so you can put it.
Hey, it's okay.
Yeah.
So we can do blepharoplasty.
Yes, you can do. It's even safer than CO2.
safer, and so we work with
And, let's,
0.5 or 1.
What I thought that you was electric shock.
So we work with 0.5
0.5 to 1,
to 1
maximum.
for the
Yes,
eyelid.
upper eyelid and lower eyelid.
And for the super,
Okay, these ones, again, you can use 1, sometimes 1.5 if it's very deep. I would recommend you,
don't need the blue stack.
no, don't do stacks. If you want, cover the teeth with some gauze. Even though it's not reaching there, because gauze, cotton gauze, it is better to protect the tooth enamel.
There's no risk to have
No.
fire and
No. That's why we say when we sterile the skin, it's better to be with an alcohol-free antiseptic.
Yes.
We never on wet skin. We clean the skin, we sterile it, dry it, and we work on dry skin. And is no need.
No. معناها without alcohol.
Like octenicept or any chlorhexidine, and is no need to touch the skin. Why? If you touch the skin and you move, it's scratching. Hold it little above. 1 minute. Hold it. Don't press the skin.
Why?
Because when you press it and you move, where you are scratching and removing the crust, and it's difficult. We don't. I like to keep the crust to drop on its own. So what you do? Keep it like this, little high.
And it will be not the same distance and not the same.
It doesn't matter. Like try to keep it,
No problem.
A fleur.
and you can pass again.
And
If it doesn't show, if the paper was black, you could see it better.
But we need maybe aspiration, huh?
This one is pushing away the.
But
Yes,
for us,
yes,
as
especially aspiration.
For venereal.
Yes, exactly like viral warts, and this
No,
is
I
better.
will not work viral with this.
I mean, if there is something, any kind of, they use it to remove also viral warts or
Yes.
plasma.
Yes.
But okay, plasma maybe is better.
I have
Yes,
plasma.
بس
This is the one.
Which one?
This is
I saw Plexir. Yeah, it's good. Yeah, it was the first. We have Intraject that it's not rechargeable. It's a platform. There is plasma. There is fractional RF. There is normal RF and electroporation. But you can work many hours without even needing to recharge on anything. It's very strong, very good for incisions.
maybe
but this,
it's expensive.
how much is that?
This is expensive.
It's
I
expensive.
paid this.
It's cheaper than this. Lower
than,
price. It's lower and it's a platform. It's not one thing about Intraject. We start again from the beginning. So we make everything from the beginning. In this, you will find all the information. It says you one by one what you are going to do. The frequency for me is not important. It's up to you.
How you can move.
How to move.
Frequency
It's unrelated. Yes. So we'll go back. We choose Erbium.
For fibrotic scars, fibrotic
Yeah.
white and fibrotic, not atrophy.
Yes,
We have
you can
So, long.
now. It's up to you.
We can we work with the one.
Yes. Whenever there is a scar, don't work with the shallow. Any scar, even if you have deep acne scar, go even to medium or even
Or,
deep. If there is severe, yes, yes. And you can work locally if there is,
only.
yes, if
and
there
after
is no.
that we
But
do, shallow.
in reality, most of the people, they have generalized problems. So what you can do, work on the severe scars deep and work more shallow more for the rest. Because if she has scars or if she has scars, definitely he has dilated pores, he has pigmented lesions, post-acne scar pigmentation. So it's one thing, and I hear always, even yesterday in the Congress, they speak about lasers and treating melasma and treating this and that. There is no laser on earth treating melasma. What it does, synergistically, it's working to boost cellular regeneration. Even Q-switch or pico-switch, what they do, they destroy existing melanin. They don't control the production of melanin from the melanocyte. So if we really want to have a good result, our patients should start prior to any light treatment from home to make some treatment with serums and creams to start controlling the production of melanin. Now, even if I make for 1 year a Q-switch or a pico-switch, or if I make every month Erbium or CO2, but I don't control the production of melanin, what happens? I recycle it. It's a vicious cycle. I remove, it comes new. I remove, it comes new. So it's good to start and continue during the treatment with a bleaching treatment with safe whitening, I don't know, vitamin C, alpha-arbutin. Today we have nanotechnology alpha-arbutin in our, we have products as well. And it really works. It really works even as a product on its own. That's why you should bring some products as well. So, the fluorphorid was my idea. You, yes. You know,
helpful for the leg ulcer.
You know, when I knew these ingredients since 1993, the first one, perfluorocarbon, it was the first perfluorocarbon is a carbon molecule with 2 fluorides. I said to Ferrari, we have to find, you have to make these products. Everybody, nobody wanted, it's useless.
No need.
No need.
Yes.
He trusted me. We started with one product, one serum. Today, we have 2 lines with the same products, different names, Renlive and Rejuve, around 13, 14 products each line, and it's always out of stock.
13, 14
Products based on perfluorocarbon. We have a cream for local fat, day cream, and a night cream. Why? During the day, you put the cream, takes oxygen in the mitochondria, together, because it's nanotechnology, the perfluorocarbons, together with lipolytic agent like caffeine, it stimulates mitochondria, it gives oxygen to the mitochondria, so it metabolizes fat. And we have also a night, we call it lipoxy cream, that it's helping to firm during the night. So during the day, you sit at your office, you put the cream, and it's like you exercise. It's the same result as you exercise and you metabolize fat.
This is magic product.
Yes, it is really for me. You know.
But maybe it's cost.
And we use it.
No. You know, I will tell you. La Prairie, they have one perfluorocarbon, perfluorodecaline, 1% in They are dual action serum. There is one serum they have 15 ml and 15 ml retinol is double serum, 1%. They sell it 370 euros.
Yes,
We have in the serum 10% maximum approved concentration for perfluorocarbones, perfluorodegalin, perfluorohexane, perfluorocyclopenafthrin, and perfluoro something, I forgot it. For 10%, I don't know what's going to be the price here, but in Europe, it's around 80 euro in Europe.
And do you use it lonely or with devices?
You use it with device. You use it. I use it after shaving every day. You can use it with acid peel. Hypertrophic scars. You have fractional RF? No.
No, I don't have.
A very good combination when you have hypertrophic scar. If you have fractional RF and you pass with the roller over 3-4 times, the hypertrophic scar, it has fibrotic collagen fibers. When you pass several times, you see immediately the scar spreading. It's like reorganizing the collagen fibers inside the hypertrophic scar. You can apply 1 day fractional RF, after 2 weeks fractional Erbium, after 2 weeks again alternating, one by one. I had one lady in London, because I used to visit London every month. We had a clinic, Biotec there. She had a boyfriend, George. She wrote the name of her boyfriend, George. Tattoo. They broke and she went to remove the tattoo. They removed it very nicely. Only some gray remained, but they caused her a hypertrophic scar. So she wanted to get rid of it. It was worse than the tattoo.
Yes.
So we did this. One, every other. Alternative. Yes.
With the
Micro needling. Radio frequency
frequency
micro needling.
RF.
Again, we have it on, it's available on Intraject. And after 2 sessions of RF, the scar, it was almost gone. It remained only little at the ends. I don't know if it was stronger there. So we made all over the area again with fractional Erbium, and it's completely gone in maximum, I think 4 sessions. It was gone.
And fractional.
Fractional, yes. Because we used the fractional RF. If we didn't use the fractional RF, the safest way to remove it, it was ablative. But because it was very, very large.
Or we do ablative, no?
Yes, that's what I mean. You can do straight away ablative for the generalized scarring or general stretch marks on the arms, on the abdomen. Now on the bust, go maximum to superficial. Don't go to medium or deep.
Why? And here.
On the décolleté again. On the décolleté, you don't need to go very deep. Go medium. Go to medium. Go to medium. Maximum to medium.
This superficial.
And if I want to go deeper, I use the stacks.
Not more than 3 stacks.
I say not more than 3, but some special cases, some doctors that they have something suspicious and they want to go deep and go around and clean it, they can go even more. They don't, that's not an aesthetic, let's say, application. It's 100% medical application. If I'm suspecting something and I want to be absolutely sure, if I don't refer it to someone, I mean, if it's melanoma, definitely it's going to be referred somewhere else. I mean, the people, they don't know that they think that it's just, I saw a lady a few years back, she wanted to remove her cellulite and she was lying on bed like this, and she told me, I want in 2 months this to go because I'm going to baptize my daughter. And I saw there, and I said to her sister, Angela, forget this and take her tomorrow
For this lesion.
for this. He said, what's this? He said, it was like this. And no, it's growing like octopus. He said, how you know? Yalla. Go to the doctor, not tomorrow, yesterday.
Ah,
It was melanoma.
it was a
It was melanoma. She was lucky. Anyway, so we can increase the stacks. Okay, I say around 3, but it could be even more. The only problem with the stacks is that it limits your frequency. You can
Yes.
use only one. That's why I prefer to increase my
frequent.
depth.
And do
I increase my depth
Bye.
by the time, by the pulse duration. It's easier. And this is the big difference with CO2, that you can play to very, very shallow to very, very deep. You can titrate according to what you have. If it's medical aesthetics, if it's completely medical indication.
For the wrinkles, for example.
You mean generalize?
No, a wrinkle.
Specific?
Specific.
Okay.
Localized.
There is 2 ways. If you have very, very few wrinkles, lines, and I want to work with plasma, what I do, with the plasma, I don't work inside,
No.
outside.
Yes.
Yes. Some people, they do it, and I'm trying to explain them that they have to work outside. Also with the HIFU, with the CFU. They tell you, but why you are not crossing the marionette lines? Why you are not crossing that? If you cross it, it's going to contract. And it shows more. That's why the makeup companies, they make makeup, they put in their products glittery, pearlescent material. The women, they think, or some women, they think that, oh, it's because to look shiny when I go to the nightclub. The reason they put the pearlescent particles is to reflect light and not to create shadow. If I make it more narrow, it's going to look even worse. So now in the wrinkles, because here we need also, in laxity, we need a generalized, let's say, neocollagenesis. We work all over the face. Unless it's something very, very specific that we are going to work locally.
Like stretch mark.
Yes, you are going to, if somebody has one stretch marks, I don't need to work. I'm going to work only on the area of the stretch mark. But on the face, I prefer to work globally. The whole face. Unless, again, there is some specific thing that, okay, I want to remove that freckle or keratosis. I did it with the ablative. Look, there. Last 2 weeks ago. Okay, still.
2 weeks ago.
Yeah, it was, I was really careless because I love the sea. I was fishing all day. I'm driving all day, and I start to feel here it was hard. I sat there one day, bam, 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 did it. Yeah, without anesthesia, nothing. And I put I put medium, and I made many times. I didn't feel it. Already hyperkeratosis, but it didn't. And what I did, but it was really painful. I had a wart. I removed it with my
frequent.
depth.
And do
I increase my depth
Bye.
by the time, by the pulse duration. It's easier. And this is the big difference with CO2, that you can play to very, very shallow to very, very deep. You can titrate according to what you have. If it's medical aesthetics, if it's completely medical. Relative, look, there. That's 2 weeks ago. Okay, still,
2 weeks
Yeah.
ago.
it was, I was really careless because I love the sea. I was fishing all day, I'm driving all day, and I start to feel here, it was hard. I sat there one day, bam, 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 did it. Yeah, without anesthesia, nothing. And I put I put medium, and I made many times. I didn't feel it. Already hyperkeratosis, it didn't feel. And what I did, but it was really painful. I had a wart. I removed it with
the place. Painful.
not painful. it was sadistic. Yeah. Anyway, so ablative,
And
very
for the
specific.
dorsum of the hand.
I prefer fractional.
Yes, fractional
Yeah.
and medium. Maximum
Yes,
medium.
yes, exactly.
Not
Yeah.
so deep.
It doesn't need it, yes. And again, many people, they ask me also for HIFU on the palms. No, I prefer this.
No, HIFU.
It's very, very superficial nerves, bone, like my hand is only bone. It's going to,
Yes.
yeah, it's good. Scar?
Scar.
Okay. Yes. There is another good indication. I didn't have time to say it yesterday. Actually, we made with a colleague of mine one test with perfluorocarbons, with fluor 4. You put local anesthesia. You want to remove a tattoo. On the eyebrow, I don't put anything. It's easy. Not the traumatic tattoo is easy. So you want to remove a color tattoo. We put local anesthesia for 30 minutes. We clean it. We sterile the skin, and we make a passage with fractional Erbium. Fractional first, medium, superficial to medium. I prefer medium, and immediately I put fluor 4 gel. It goes down. Then I work with the Q switch or the MPP, that is Q switch and pico switch. And in the past, with the Q switch, because there was frosting, you were allowed to pass only once because it was burning the skin. When you use the fluor 4 and you can pass even 2 and 3 times without any problem. It doesn't create so much frosting. When you finish, you reapply again fluor 4 and
Only one session of
no.
each.
In one session, you make both.
Two,
Yes. And
Yes.
I had many cases with traumatic tattoo on the eyebrow that they want to clean and make it again. I make one pass with fractional Erbium, one pass with NPP, 2-3 times, it was gone. This is easy. The other one that they make with needles in the army, in the prison, it's very easy. What is difficult is the professional. Yes. Okay. So, we say again, the ablative is limited to small lesions or hypertrophic scars. Also, it can be used in age spots, solar lenticular, the remoted solar lenticular, one there, one there. Of course, again, those you can use also the Q switch as well on those. So, but if you don't have the Q switch, the best solution is fractional erbium or ablative if it's only one. If you have a back that is full of solar lentigo, it's better to make more treatment with fractional, because if you start to make one, at the end it's going to be his back very solar lentigo, one there. Of course, again, those you can use also the Q switch as well on those. So, but if you don't have the Q switch, the best solution is fractional erbium or ablative if it's only one. If you have a back that is full of solar lentigo, it's better to make more treatment with fractional, because if you start to make one, at the end it's going to be his back very painful, because it's traumatizing. The ablative is traumatizing. The fractional, no. The only problem maybe she will have is that, like sunburn, she will sleep on his belly during the night. And I treated someone, a boy. His mother is a beauty therapist, and he had pigmented acne scars, not really scars. It was all pigmented. Everywhere he was spot, he was scratching it, pigmented, because it was going there. In 4 sessions, everything was clear, but it was
without active acne.
No.
Only scars.
It was old acne.
Pour la pigmentation.
Occasionally he had sometimes a fresh spot, but not like when he was in the puberty. Yeah.
Mais occasionnellement, عنده تبدأ une petite excoriation ولا حاجة. بتدخلها pigment.
Now, they used to recommend, or they recommend, to put on the treated area. Sometimes they even recommend what was the name recently, like a tool with Sofra tool, all this from Brussels. I remember in the past they had for the burns. I prefer to let it in the air dry. If my patient feels uncomfortable and I'm going to use something, if I want to use something, I'm going to use fluorophore. We used to recommend.
But we don't have it.
Yes, we are going to have it. We are going to bring it.
Yes, but we will give it to the patient.
You can give. There is professional and there is retail. Yeah. I had many cases that I put it even immediately after the treatment. It cools down the skin, but the result is there because we need the irritation to remain, because the irritation inside is useful. It's stimulating the regeneration. We used to recommend Restore Cream. Biotec used to recommend Restore Cream after Erbium. It was oily. It was many ingredients that they are not absolutely, as I said, remove everything. And if you want to use a cream, it should be only fluorophore. Fluorophore professional is 150 ml, and it's much lower price because it's professional than the. So you can use it at least when you finish your application, especially on the face, and you can recommend him to continue at home. Anyway, they will not throw it. I tell you, I'm using it every day for shaving, after shaving.
since we have this they don't need to put anything.
Sun protection, only sun protection. And I ask them now to make sun protection with fluorophore. It's going to be a very nice product. The body treatment is easier. Why?
Yes.
The body treatment is much easier. It's like avec for skin rejuvenation because it's very, very deep. It heats up the collagen fibers, it stimulates neocollagenesis. And if you go